everyone. So in this video we'll discuss about antagonism and types of antagonism. So first of all, what is antagonism? So antagonism is something when one drug decreases or abolishes the action of another. Okay? So let's say for example there are two drugs A and B. So individually they will have effect of A plus effect of B. If it is greater than effect of A plus B, then this is said to be antagonistic pair. Okay, so there are various kinds of antagonism. So those are physical antagonism, next is chemical antagonism, physiological or functional antagonism, and the last one is pharmacological antagonism. So let's discuss now these various kinds of antagonism. So first is your physical antagonism. It is based on the physical property of the drugs. For example, charcoal, it absorbs alkaloids and thereby prevents its absorption in alkaloid poisoning. Okay. Next is chemical antagonism. Here what happens? Two drugs they will react chemically. For example, potassium permanganate KMnO4 it oxidizes alkaloids. Now where it is used? It is used for gastric lavage. Next is chelating agents like British anti-lucide. Okay, calcium disodium editate. They complex the toxic metals. Okay, nitrites they form methemoglobin which reacts with cyanide radical. Now, drugs may also react when they are mixed in the same syringe or infusion bottle. And some of those pairs are thiopenton sodium with succinylcholine chloride. Next is penicillin G sodium with same succinylcholine chloride. Heparin with penicillin or tetracyclines or streptomycin or hydrocortisone. Okay, all this should not be mixed in the same syringe or infusion bottle. Okay, next is physiological or functional antagonism or functional antagonism. So what happens in this? Two drugs they have action by two different mechanisms on two different receptors. Okay, but their actions are opposite on the same physiological function. For example, histamine and adrenaline on blood pressure and bronchial muscles. Okay, so they exert their action on two different receptors, but one increases the BP and one decreases the BP. One causes bronchoconstriction and the other causes bronchodilation. So like this. Similarly, hydrochlorothiazide and amiloride on urinary potassium excretion. Similarly, glucagon and insulin on blood sugar level. Okay. And the last one is receptor antagonism. So So one drug, it blocks the receptor action of another. Okay. Receptor antagonists are selective. Okay. That means what? That means, let's say, take the example of anticholinergic drugs. Okay. So this anticholinergic drugs, they will oppose the intestinal smooth muscle contraction by the cholinergic agonists. Okay. But this will have no effect on the that produced by histamine or 5-HT. Okay. So anticholinergic drug will oppose the smooth muscle contraction by the cholinergic agonists only at the cholinergic receptors, but they will have no effect on the those produced by the histaminic receptor or 5-HT receptors. Okay. So receptor antagonism, now we can divide it into competitive antagonists and non-competitive antagonists. We'll be discussing the differences between competitive antagonist and non-competitive antagonist in a separate video. Okay. So for now, you remember that the drug antagonism, it is when one drug, it decreases or abolishes the action of another drug. That means the effect of drug A plus effect of drug B will be greater than the effect of drug A plus B. So what are the types? Physical antagonism, chemical antagonism, physiological antagonism, pharmacological antagonism. So what is physical antagonism? One drug, due to its physical property, it decreases the effect of another. Like for example, charcoal absorbs the alkaloids, so it is used in alkaloid poisoning. Chemical antagonism, when two drugs, they react chemically. Like for example, potassium permanganate oxidizes the alkaloids. The chelating agent, they form complexes with the toxic metals. Okay. Then what is the physiological antagonism? Where two drugs, they act on two different receptors by two different mechanisms, and they have opposite action on the same physiological function. For example, histamine and adrenaline on blood pressure and bronchial muscles. Then the last one is your receptor antagonism. It blocks the receptor action of the other. So the receptor antagonists, they are relatively selective. For example, the anticholinergic drugs, they oppose the action of the cholinergic agonists on the intestinal smooth muscle contraction, but not that produced by histamine and 5-HT. So these receptor antagonists are further classified into competitive antagonist and non-competitive antagonist, which we will be discussing in a separate video. Okay, thank you.